You are very new to Northwest, but you've had some time to look back and see how COVID-19 has impacted healthcare. Some things that worked, some things that didn't. Give us some insight.
Yeah, I tell you what, there's a lot of lessons learned from this time period. We all felt it personally, but within the healthcare space, we learned a couple things that certainly got highlighted across the country and certainly here in Tucson as well. And that's access to great healthcare, and having healthcare close to home became really pronounced. The second thing I would mention that's an important part of this is communication. We really had to rethink, and in many cases redesign, how we communicate and how we get really important pieces of information to those on the front line and to those that are, having to change their work to meet our patients' needs. The other part that's been interesting now that we're at a different point in the pandemic is around making sure that you go and see your doctor again. Because that's a really important part that we're still seeing emerge now as people have put off some needed care.
You talk about access. Despite the pandemic, Northwest managed to open a facility in Sahuarita. There's another one coming online in Vail. How did you manage that?
Well, those things don't happen quickly and without a lot of planning. So I mentioned earlier, Northwest Healthcare has clearly been striving to provide access to care across the greater Tucson and surrounding areas. And so I believe Vail, I was lucky enough to attend one of their recent Chamber of Commerce meetings, and someone mentioned that I think they were one of the fastest growing areas in Arizona, actually. And so being there, making sure that growing community has access to great healthcare was very important to us, identified a number of years ago. And same thing with Sahuarita, which I'm working on the pronunciation, apologize, and the Houghton Hospital that'll be opening up later this year. Those are emerging, growing communities with a lot of exciting opportunities there. They need a hospital, they need a healthcare, they need that access to local healthcare. And so we're striving to meet those needs of our growing communities.
On this program, we're talking a bit about the nursing shortage. You talk about expansion. Do you have the staff to meet patient needs?
Well, we do, and it's not without its challenges. We're aggressively recruiting. We've got a lot of great nurses here locally, thankfully, but with growth, you need more. And so we've seen a lot of national interest. I've been very excited to see that we do have, neighboring states. We're getting great applicants from neighboring states who are really excited to join Tucson and Northwest Healthcare. So we will recruit, our talent and our nurses to meet our growth needs.
As I understand it, Northwest Healthcare is complying with the federal requirement to post prices on the website. Is that working as it should for the patient?
That's true. That's a great question. I think directionally, nationally, it's the right thing to do. I do think that we can all benefit by having a look at that. I don't know that we're where we need to be to where I could feel confident saying to my mom, hey, hop online and check us out, and she would know what to do, or even how to interpret what's there currently. I think we still have a ways to go as an industry to strive or to reach transparency. That's the word I've heard associated with it. And I think how we communicate that in a way to our patients, our communities, we still have a lot of work to do there because it's a complicated industry.
Brian Synott, the CEO of Northwest Healthcare, thank you.
Thank you so much.